Welcome back, everybody, to the OPT Network. This morning, we're talking about trauma and how it affects children and families of those children. Our guest this morning is Carissa Grant. She joins us from Children's Advocacy Network, and she is a trauma therapist. Carissa, good morning and welcome.
Thank you. Good morning.
So, first of all, Carissa, let's talk about CASA and the work that CASA is doing to help promote getting the help that children who have experienced trauma need.
Okay, so CASA specifically, working with foster kids, that's the program that have volunteers that are specifically designed to be paired with a child to be their person through the trauma and through maybe different placements. They're kind of the consistent piece while a child is experiencing trauma. But as far as our therapy referrals or where we get most of our, children that come to our therapy program, a lot of that comes from the Children's Advocacy Center, where the forensic interviews are taking place.
So what happens when children are too young to articulate that they've experienced trauma? How do we know?
We can usually tell if a child has experienced trauma by behaviors. Most of the time they communicate with behaviors as little kids, and usually I can tell if they're experiencing symptoms as though they're having severe meltdowns. They're unable to regulate their emotions. Sometimes they can't control their bodies because we know that if a child experiences trauma at an early age, they can still be experiencing symptoms even though they're unable to communicate those things. So I see oftentimes it's mostly emotional regulation. They're unable to regulate their emotions or even communicate their emotions effectively. So it comes as they're either shutting down and have no emotions, or they're having a lot of emotions and are just spewing them everywhere.
And sometimes that looks like defiance, maybe, and behavioral challenges. How do you help families that have children that have been affected by trauma to understand the differences and get the help that they need?
So most of the time when I'm working with families and children of that age, I always tell them behaviors are not the child. It's not who they are. It's not, don't take it personally. Usually behaviors are communicating something to us. So something feels off, something feels bad. They communicate by behaviors. And so I also I like to start out by saying, this kid is not bad. This kid is not a bad person. Lots of times families will say, well, this kid is just awful. I can't do anything with them. They're doing this, this, and this. But it's important to pull them back and say, hey, what is this behavior trying to tell us and why?
Wow.
Once I refocus them and reframe it in that way, they become a lot more compassionate and a lot more willing to explore that behavior instead of just panicking and wanting the behavior to go away immediately.
Right. So it almost feels like a mystery, especially when a child is not able to articulate how they've been traumatized. So how do we unravel this mystery?
So what I do, depending on age, is if I know they can't communicate or they're not able to remember, I usually just start with, okay, how's your body feeling? Okay, when was the first time you felt this way? Or do you remember? Do you feel this way at night? Do you feel this way during the day? Is there a certain person that makes you feel this way? So it is a mystery in the sense of you have to really dig to see where it's coming from. But I do a lot of trauma focused. Okay, I know that these are the symptoms I'm working with. I don't always focus on where's it coming from because sometimes you'll never get it. I always focus on the here and now. Okay, what are they experiencing? And let's really try and focus on the trauma symptoms.
So let's talk about the triggers. Maybe a child is unable to articulate where those feelings are coming from, but there's a trigger that they don't necessarily know is a trigger.
Mm-hmm. Yes. So most of the time, you can kind of map it by behaviors. So, say they can't tell me something makes them feel bad, or they don't even know. Most little kids don't. But say they're having a meltdown as soon as it's time to lay down at night. Say they're having stomach issues before going a certain place. Um, we know that trauma symptoms can be very physical. And so often we can kind of pinpoint, okay, this is a trigger for them because they're experiencing these type of symptoms.
Hmm.
Doesn't mean they have to really say anything.
Hmm.
Um,
And so, how do you deal with those triggers for a child who has meltdowns when it's time to go to sleep? How do you deal with that without feeling like this child is trying to control the narrative of when they'll go to sleep or they're just defiant? How do we deal with that trigger now that we kind of understand, okay, maybe this is a trigger because this happens every time it's time for bed?
yeah, so I think first acknowledging this child and their fears that they're real
Hmm.
is an important step. Kind of, it's easy to say, oh, they just don't want to go to sleep, right? They're just controlling the environment. But acknowledging first, okay, this fear is very real for them. How do we work with this? So, some things that I implement with my kids who are afraid of the dark or have nightmares or things like that. I do a lot of desensitization to that, meaning we'll do some work in the dark sometimes to kind of get their bodies and know that it's safe. I sometimes implement with little kids like little guided meditation stories before they go to bed. I've seen that decreases nightmares in children. And I also kind of almost always get them in control of the nighttime routine. Okay, you know you have to have a routine, a bedtime routine. What would make you feel safe?
Hmm.
Okay, do you want to read you want to read a book before you go to bed? Okay. Give them something that they can say, all right, I'm in control of my space and myself, and it's going to be safe.
Hmm.
So, okay, you want to brush your teeth and then read a book. Okay. Is that really a deal breaker for parents? You know what I mean? So, it's kind of pulling back and saying, okay, these are the things that have to happen. Which order do you want them in? What can we throw in there that will make them feel safe and calm? Um,
But don't you think, though, Carissa, before we can get there, especially for old school parents, because now you have older parents raising grandchildren or even great grandchildren that have decided that we're going to do it the way that I say that we're going to do it, not really necessarily understanding that these control issues are about something. So, how do we sort of reframe the fact that just because you get a child and you love them and you give them a routine, that doesn't negate their trauma?
no. So I think regarding control, I like to kind of tell them, I kind of go through an exercise of, okay, tell me, I kind of do like a control exercise. How would you feel if you had no control or had made any decision? Which happens when you experience trauma. You don't have control of your body sometimes. You don't have control over any basic decisions. You don't have control over anything. So everything feels out of control. And so even when they're in a safe environment, they bring that with them, this feeling of being out of control. And so I try to communicate to parents who are just like, no, it has to be X, Y, Z every single night, and it has to be what I say and what I do. And I'm like, you will continue to have these out of control experiences because they've taken that from their trauma experiences into their present now. So until you're able to give up some type of control, you have a kid who feels very much out of control and will act as such.
Wow.
And so trying to reframe that in that sense of, okay, you know, this they still have this feeling even if they're in a controlled environment.
Mm. So really, it's the battle of wills, you know,
Mm-hmm.
my control versus your control, and these are conversations that we have to better understand how to get better, how to help children and people who have experienced trauma get past it so that they can live a more normal, more productive life. Let's take a break here, but when we come back, we'll talk about how to help those families start the process of understanding and unpacking trauma. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Carissa Grant. She's from Children's Advocacy Network, and she's a trauma therapist. And she's really breaking down the trauma that happens within, sometimes that's unspoken, but really lies within children and people. And so before we went to break, we were talking about the battle of wills. And I said to you during the break that we adopted 2 children, and I was one of those parents, one of those old school parents that felt like, it's going to be my way, until I began to understand trauma. For those people who, as you said earlier in the last segment, feel like their children are just bad kids, they're unruly, they're unmanageable, what do they need to know about past experiences that affect children that they're not able to talk about?
Like, what do they need to know in order to help them?
Exactly. And to start the process.
I think if they are able to change their viewpoint of the child in general, because it's easy to get very angry or get very frustrated, and to feel as though, well, this is it. This is just who they are, right? I think if they're able to change their viewpoint of the child in general and have a positive outlook on who they are and their future, I think that changes the whole game.
Mm-hmm.
Because that's one of the biggest roadblocks is, well, this is just how they are, and it's always going to be this way because this trauma happened. Mm-hmm. But they need to know that there is hope, and that because we do have trauma therapy and we have people who work with these things specifically, that this is not, the children are now not lost causes because they've experienced a traumatic event. Mm-hmm. They can continue to go on and grow into successful humans, and be happy with mm-hmm. themselves and not even experience these behaviors forever mm-hmm. that they're experiencing right now. So I think they need to know there's hope, and that this is not the end for them as children or teenagers.
So talk about very young children that experience anxiety, like nail biting and chewing on their clothes, and just real nervous habits that babies you wouldn't think would have. How do we help those children to move beyond that, to feel safe and not to feel so anxious?
I think if you so when a traumatic event happens to a child, regardless of age, they can be very young, they now take on all of these feelings. So anxiety, sadness, multiple things. It's important to know that feeling has to go somewhere. Okay. So either they have to keep it and hold it. So they have behaviors like nail biting, skin picking, different things like that, because they need an outlet. They need somewhere for it to go. And until someone helps them learn how to have an output of the anxiety in a healthy way, it will continue to present as anxious behavior. So that's what we do in therapy. We talk about, okay, we have this feeling. Mm-hmm. It has to go out. It can't stay in your body. So what are some things we can do to cope with this feeling? Do you like to draw? Do you like to color? Little kids like to color. Can we blow some bubbles? Can we play with a certain toy that calms our body? Once you frame it as in it cannot stay, it has to come out. Mm-hmm. But here's how we do that. They're much more likely, kids, to say, oh, okay, so this doesn't have to stay with me forever. Mm-hmm. And once kids learn how to cope and start learning other behaviors, positive behaviors regarding anxiety, mm-hmm. then that's where we start. That's the helpful, mm-hmm. we're going to move forward.
Mm-hmm. Does it matter, Carissa, if kids are ever able to articulate the trauma that they've experienced? Does that matter in therapy?
No. I don't feel as though they would have to tell me, especially little kids, mm-hmm. Exactly what happened for me to know that this is exactly what I'm working with. It's important for older kids or maybe even kids who can articulate to
Mm-hmm.
eventually be able to share that in a healthy way,
Mm-hmm.
but it's not a absolute need, um, to me anyway.
Mm-hmm. And so let's talk a little bit about sensory processing, because until we adopted two children who came from traumatic backgrounds, I had never heard the term and didn't know what it meant. Tell us about that.
So sensory processing means that basically if there's sensory wise, so it could be lights, it could be touch, anything dealing with the senses. Sensory processing is a disorder where it is hard to process those things in large amounts, meaning when you do have sensory processing disorder, small things can feel very much larger than what they are, meaning they just have a harder time processing different environments, sounds, um, touch, feelings of clothing, things like that. And a lot of that with trauma comes from more so attachment, lack of attachment,
Mm,
usually at birth or early childhood. If they have lack of attachment or if there is no attachment to someone,
mm,
that
wow.
attachment or even feelings of attachment can send them into sensory overload. So if it's holding, if it's all of a sudden I didn't get held for 2 years of my life and then all of a sudden this person walks up and wants to hold me all the time, my body's not going to feel very good.
Wow.
Um, you know,
Mm-hmm.
did I have clothes or shoes on for the first 2 years of my life? Oh, now you want me to wear these shoes and these socks, but my body doesn't feel good when this happens. So, related to trauma, it's very much based off of lots of earlier experiences.
Mm-hmm. Mm-hmm.
Um, did I sleep in a dark room with no noise for years, and
Wow.
now I have this music playing? So it's very much related to trauma in lots of ways.
And as I sit here and listen to it, the things that the person who comes in uses to make life better is the very thing that the child or the person who is coming from trauma might recoil from because it's not their normal.
Right, right.
So that in itself is challenging. And so when we send these children into the school system and they have not, their parents or whomever is raising them have not understood that there has been trauma or know that has been trauma, but haven't really dealt with it in terms of
Mhm.
therapy, then it presents itself in all sorts of ways in school. So how do we begin to have the conversation for those people who have children or teens that are dealing with therapy, saying, okay, we do need a professional skill set. We need something like trauma therapy to get this person in a more stable environment. How do you begin to speak to that?
More so from them going back into like the normal world. Um, are you asking me to talk about in the education setting or just in just general?
Well, in the educational setting, because now you've got teachers involved, and to a teacher, that child presents as a problem child
Hmm.
because that teacher may not know that this child comes from trauma.
Hmm.
The parent doesn't know necessarily the backstory of the trauma. So we just feel like if we love them enough, if we give them structure enough, if we check all of the boxes, they should be fine. But then there's this whole piece that's missing that prevents that child from being who they can ultimately be because we really haven't dealt with the trauma.
Right. So I would just say moving into that conversation or starting that conversation is how are we communicating with the child in general? Okay. So if it is a environment where say we're in an education setting and teachers are you have to be X, Y, and Z, and your behavior has to be X, Y, and
Right.
Z. This is the standard. If you can't meet the standard, then, this is not okay. We have maybe behavioral meetings, we have blah, blah, blah. But I think what usually happens is there's a lack of communication, meaning the child is communicating in ways that they've always communicated.
Mm-hmm.
Whether it's behavior, whether they have a special set of survival skills that they're using still. They have all of these things that they feel as though I've communicated this way, and I have always communicated this way, and so I'm not used to being communicated with this way, and so I'm just going to kind of buck the system, right? It's just like I'm going to rebel
because that's all they know, right?
It's all they know, and because they haven't been taught anything different. And so I think the conversation has to be, how do we listen to them and start communicating with them in a healthy way and teach them how to communicate? So, oftentimes I have a struggle even in the therapy room of, well, my parents are not listening. They are not listening. And if they are listening, they're not taking the information and then actually hearing me. So we do a lot of, okay, how do you communicate, and how do your parents communicate? How are your teachers communicating to you? This is what is a healthy communication skill, because they usually don't have that. And it's a lot of just education with not only the child, but the teacher as well. Okay, it is healthy for you to do these things at school. It is healthy for you to have this structure. It's not comfortable because you've never had it. It's usually uncomfortable, right, if you have all of these things. But it's also important for the teacher and the parent to know that too. This is not a comfortable transition if this life of trauma has always been a thing. And now you want to send them into a safe, healthy environment, right?
Wow.
So it's not going to be comfortable. It's not going to be easy. So I think we just start with, how do we communicate with this child in the most effective way? It may not look the same as every kid. And I think they need to know that's okay.
That's powerful. Let's get a break here, but when we come back, we'll talk about what the Children's Advocacy Network is doing to be the change that they want to see and how the community can help. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Carissa Grant. She joins us from Children's Advocacy Network. She's a trauma therapist, and she's really helping us all to understand trauma and how we can help our children and families to grow and get better. And before we talk about how you guys are expanding and really, really spreading the word so that people who are having some of the challenges that we talked about this morning can reach out and start the process of therapy, tell us about the dangers of people not getting help for a child that comes from trauma, even if you don't realize that they've come from trauma. What are the dangers in that?
The dangers of never receiving help is that eventually you will have to deal with the trauma. Even if, say, you don't do it through your whole childhood, say it doesn't come up for you until adulthood. Regardless, it's going to come out in some way. So sometimes that manifests as drug use. It's a coping skill to trauma. Maybe one day, because of drug use, they're homeless, unable to hold down a job, relationship issues, being unable to trust someone to maybe marry one day or have children one day.
So it never really goes away until it's addressed and worked on.
Yes. So it's important to know it will eventually come out in some way.
And so you guys are expanding, and to do that, we know that COVID is rampant. And so you have been fundraising, and that's sort of been postponed because of where we are. Tell us about the expansion and about raising money to create more awareness.
So as far as our therapy program, so we are expanding, meaning the need is so great for trauma therapists in the area, unfortunately, that we have recently added a second therapist to our team to start seeing more kids. We're trying to implement a parent support group for parents of children who have experienced trauma, because it's a lonely world. Once you're in this club, you don't want to be invited to. And so we really want to support the parents of the kids who've experienced this. And so they have a kind of a community themselves. And then we've also started our therapist meetings. Our trauma therapist meetings are the last Friday of each month. And what that is we're bringing all the therapists that specialize in trauma together in the area. And we're talking about which trainings can we bring to Central Louisiana to kind of empower them to continue the trauma work. Because what we've realized is that the resources of training trauma specific are lacking in this area. And so if we can try and pull those in to support our therapists we already have here, we're going to be able to reach more traumatized children. And so we're just trying to pull our resources together, get to know one another, and see how do we effectively manage this high level of need for trauma therapists in the area. And so those are a few things that we're doing as a therapy program.
You know, the thing that concerns me a lot, Carissa, having two children that come from trauma, what concerns me is that when children go into the school system, and we're already asking teachers to do so much, and many teachers don't understand trauma, and some do, I understand that, but it comes across as defiance. It comes across as a child who is disruptive, who is defiant, who is unmanageable. And these children will ultimately be labeled as bad children. And because we're already asking teachers to do so much, it is a concern for me as a parent that those children will slip through the cracks, be labeled, and really be ostracized and pushed to the side. And I wonder what moves can be made, especially for those children who have now become part of non-traditional families. There's a grandmother raising them or an auntie raising them. You know, is there a mechanism in place to meet those kids right where they are so that they can be productive in school?
Right. And I think that is kind of the conversation that's kind of on the table right now. Is we know that these children are everywhere. How do we reach them in the best, most effective way possible? I love teachers, and teachers have such a huge load already. So how do we go into the school systems as therapists who work and specialize in this? How do we even support them in this journey? And so I think as a community and as therapists in the community, we're having the conversation of where do we start? How do we start to support people where they are so that we can support the kids where they are?
Absolutely. And you know what? Maybe we can bring a group of therapists together, Carissa, where we can have the conversation on air. And for those parents this morning, or those families that are experiencing some of the things that you've been talking about this morning, and they're saying right now, okay, I didn't necessarily understand that, but I think that my child needs help. How do they connect with Children's Advocacy Network and start the process of therapy?
So they can always call our Children's Advocacy Center. That is where all of our referrals come from. And we're also a good starting point referral wise, even if they can't come see me. We have a long list of people in this area that would be willing to help them. And so if they have a child that they're like, where do we even start? They can call us and we can help them with that process. It may not be me. It may be somebody else in the area that specializes in trauma. But because we've built that network and those connections, we can make sure the kid gets the help they need.
There you go. Before we've got to let you go, I know that you guys were slated to have a gala, but it has been postponed due to COVID. Give us the update on what that will look and feel like, hopefully.
So our gala is hopefully going to be the exact same, but it's going to be on November 11th. So it is from 6 to 9. And so what this is our main fundraiser for all of our programs. So this will support all of our programs. And our focus this year is therapy programs and expanding the therapy services.
There you go. And we'll revisit that as November approaches. I mean, it's really right around the corner. Right. And as we look at what the virus is doing and how you all are coming, we certainly want to be a part of the conversation in the community and help to spread an understanding of trauma and how it can be resolved, and those children can be the best, most incredible part of themselves that God created them to be, with the help of therapists like yourself and others. Thank you so much for the work that you're doing.
Yes, ma'am. Thanks for having me.
Indeed. Carissa Grant has been our guest this morning from Children's Advocacy Network. She is a trauma therapist. Stay on point. We're back right after this.